Okay, we have with us this evening Catherine and Henry. Catherine is 74, Henry is 79, and they've both been on testosterone replacement since 2005. So it's a little over 3 years for both of them. And what was life like before testosterone replacement? Let's start with Catherine. What was bothering you at that time?
Fatigue. I had a terrible vaginal itch that drove me crazy for many, many years.
How would you rate the fatigue? Severe fatigue, moderate fatigue, and how long had it been going on?
I would rate it moderate. How long? Oh, for quite a while.
Years?
Years.
And this recurrent vaginal itch had been going on for how long?
For years, at least for, oh God, maybe 30 years.
And you had seen gynecologists on
Yes.
numerous occasions, I imagine.
Constantly.
And any help?
Nothing.
Nothing. And okay, so fatigue and a vaginal itch and depressed at all?
Depressed.
Anxious at all? Depressed.
Depressed.
Significantly depressed?
I would say so.
And how long had that been going on?
Oh, for many years, 5 years maybe, maybe a little more.
Okay. And also you told me you suffered from a major lack of self-esteem almost your entire life,
Yes.
or for your entire life.
For my entire life.
That was a major part of your personality and character.
Yes.
Okay. And what about your sexuality?
I had no feeling for sex at all.
At that time, this was 3 years ago, so you were 71 at the time.
Right.
And for how long had you had no sexuality, no libido?
About, I don't know, 10 years maybe, 6 years.
You hadn't really had any any intercourse for about 3 years or so.
Right.
And you weren't even thinking about it anymore. Right. Okay. And you, Henry, what were you like then?
Well, as I told you, I had this fatigue where I couldn't walk for a long time. But now it's
well, let's just talk about what it was like back then.
Okay. I would walk. I used to go, my exercise is walking.
Yes.
So I'd walk a few blocks and I just couldn't go on and I had to turn around and come home.
I remember you telling me then that you got short of breath when you walked.
Yes, short of breath too.
And what about your energy levels at that time?
They weren't all that great. They're much better now.
You fatigued easily then?
Yes, I did.
And what about your sexuality then?
Well, it's the same as hers. I couldn't say otherwise. Okay. It's the same as hers.
You weren't
I hadn't thought about it. I thought that was it because of my age, I guess.
And that had been quite a few years?
Yes, it has.
Quite a few years. Okay. So then, actually, I recall why we started you guys on testosterone. I don't know if you do, because a relative of yours was on testosterone replacement,
Yes.
and you were sitting on the exam table, and you said, "I wish I could get those shots." And I said, "Well, you can." So we did the blood test, and we started you on testosterone replacement in 2005. So what happened?
Oh, yeah, it's great.
Well, let's start with the beginning, with the constant tiredness and fatigue.
Well, that has gone. I just get normally tired after a day's work. But that's about it, you know.
That severe fatigue is gone.
Is gone.
And what about the vaginal itch you had?
That went away, which was, that itself was a blessing. Because all my life I suffered with this itch. But that went away, and it was marvelous.
Yeah. I would tell whoever's watching and listening that I have yet to come, in 10 years now, I have yet to come across a woman with a vaginal itch that it didn't go away from testosterone replacement.
That's marvelous.
Yeah. Your sexuality?
Oh, my libido is better. Yeah, I have it now, you know, which I didn't have
And
before.
you've become sexually active?
Yes.
On a regular basis?
On a regular basis.
And it's good?
And it's good.
Okay. And you even with this major lack of self-esteem that you had all your life, there's been a bit of improvement in that, you
Oh
say?
yes, it has been a bit of improvement. Not much, but that's my makeup.
Right. And your depression?
Depression is better.
Okay, so all in all, it's been a very positive thing for you?
Very positive.
Any side effects to speak of?
No. Yes. Hair.
Are you still having a major problem with hair?
It's not that it's a major. As long as I keep after it, it's okay. Facial hairs, you know. But it doesn't bother me. You know, it's not a big thing.
It's not uncommon for women to get into their middle 70s to have facial hair in any event.
Yes,
without
that's true.
testosterone
That's true
replacement.
because I'm a hairdresser and I look at a lot of women at my
Okay.
age and older.
And what's happened with you with the testosterone replacement? Let's
Well,
start with the physical, with the walking. Was a
Well,
problem for you?
I have the energy to go on for long walks, and it doesn't. But the other thing that bothers me, my feet hurt. then I have to stop.
Okay.
But the energy is there.
How far do you walk now?
Oh my God, a few miles a day.
You walk a few miles a day, from a few blocks to becoming exhausted, and now a few miles a day without being exhausted.
Right.
And do you get short of breath anymore?
Not at all.
No shortness
Not
of
at
breath. You really didn't have any problem with self-esteem or depression or anxiety, but what happened with your sexuality?
It's revived. It's back.
Is it a little bit? Is it revived considerably?
More exceeding my expectations, I would say.
Okay. And you're satisfied with it?
Yes, I am.
Yeah, much better than nothing, right?
Oh yeah. The days we don't have is recovery time, recuperative time.
Okay, and there was something you had mentioned about his personality.
Yes.
What have you noticed with that?
I noticed that he's more jovial. He's nicer. He doesn't get. Usually he has a short fuse, you know, but he's like calmer. He's a nicer person. He is. He's a nicer person. We have fun. We have laughs together, which we didn't have years ago.
Happier.
He's happier.
Very, very common word with testosterone replacement. And you also mentioned that when it gets time, when he's close to needing another shot, that tends to wind down a little bit. Starts to get a little quieter, right? Give him a shot and he perks up again.
Perks up.
Yeah. Okay, well, it's been a pleasure dealing with you guys. It's been a pleasure seeing you get younger, which really you are. You both look a lot younger than you did 5 years ago. We're going to get some photographs, hopefully, to make comparisons. Thank you very much for being here. You've been a great help.
Thank you,
Thank
Doctor.
you for being my doctor.
It's been my pleasure. Okay.